I'm Dr. Praneeth Terlukunta. I will be presenting on the phenotypical variation with age in ceramide kinase like protein related I'll be presenting on the phenotypical variation with age in ceramide kinase like protein gene related retinitis pigmentosa in a single family. So we know that among the inherited retinal dystrophies, retinitis pigmentosa is the most commonest, and based on its heterogeneity, it is very complex in its phenotypical variation. The objectives of my presentation are to understand the various phenotypical presentations at different ages in CERKL gene related RP patients, and to differentiate these phenotypic findings from the other typical RP phenotypes. So the first case is of a 10-year-old boy who came with complaints of reduced central vision from the age of 6 years. The best corrected visual acuity was 20/80 and N10. On further history, there was no night vision or peripheral vision problems. The fundus examination showed mild arterial attenuation and central macular atrophic changes. The fundus autofluorescence showed a hyper-autofluorescence ring at the macula, and the OCT showed there is loss of photoreceptors layer. So the full field ERG showed extinguished responses with reduced responses of rod cone amplitudes. So based on this, we came to a provisional diagnosis of retinitis pigmentosa with macular involvement, cone rod dystrophy, and Stargardt's dystrophy. This is a 5-generation pedigree charting showing a kind of equal affection of males and females, so showing autosomal recessive inheritance. So clinical exomic sequencing directed towards the retinal dystrophy panel was performed based on the history and the clinical findings. So we came to a diagnosis of CERKL gene related retinitis pigmentosa, as there was a frameshift deletion of exon 7 on chromosome 2. This is the second patient who was the mother of the 10-year-old child, and she complains of decreased central vision since childhood, and on the second to third decade there was decrease in the peripheral vision as well. Her vision was hand movements, and here we can see that there is pallor of the optic disc, there is arterial attenuation, macular atrophy, bony spicule pigmentation, and also the chorioretinal atrophic changes. And the findings of fundus autofluorescence also they are going in favor of the typical RP changes. There was also loss of photoreceptors on the OCT. This is the third patient who was the nephew, and he was the first cousin of the 10-year-old child, that is the case 1. He had findings similar to the case 1. There was also one more patient. She was a 42-year-old female, and she had findings similar to case 2. So what have we seen commonly in all these patients is the macular photoreceptor affection and the severely affected full field ERG. And in younger patients, what we have seen is the mild or no disc pallor and minimal arterial attenuation. And common to older patients was the prominent vascular attenuation, total central and macular atrophy, bony spicule pigmentation, peripheral scalloped chorioretinal atrophic patches. So in comparison to the typical RP, the CERKL gene associated retinitis pigmentosa shows early macular involvement, paucipigmentary changes, and scalloped chorioretinal atrophic patches in the later age. So these are the take clinic messages I would like to underline. That is, the CERKL gene related retinitis pigmentosa shows a wide spectrum of phenotypical changes at different ages, varying from early macular involvement and paucipigmentary changes in the first decade to severe macular atrophy and typical RP-like changes later. And knowledge of this changing phenotype due to the CERKL gene from early to later part of their lives helps in appropriate diagnosis, early visual rehabilitation, and career counseling. So this present family, it highlights a crucial role of the genetic counseling and testing for future generation risk assessment. That's all for my presentation. Thank you all for the patient listening.